Well, I am honored to introduce Becky Borgman, who is the Maternal and Reproductive Health Director with Every Step, and Aubrey Kitchell, who is the West Central Indiana Female Director in Tippecanoe County. So again, they're going to be talking about local leadership and highlighting the incredible work that they're doing at the community levels to support families and improve maternal and infant health outcomes. So they've both been driving change in their communities, building partnerships, and creating programs that truly make a difference. They're going to share their experiences today, strategies, lessons, and their passion, and lessons that they have learned from leading at the local level. So we're so thrilled to welcome both of you today. So hello, Becky and Aubrey. Thank you for being here. So we're going to start with Becky. She's going to share her work at the local level and the programs that she's been implementing to support families in her community. So Becky, I will give you the floor.
Thank you. Okay, today I am going to share more about the suitcase clinic, which I shared briefly about yesterday, but how we are using it to reduce barriers to access. Next slide. Every Step is the subrecipient of the Title V Maternal Health and Child Health Block Grants. Under these grants, nurses serve a variety of services, including anything from health assessment, so breastfeeding, safe sleep prevention, preterm warning signs, post-birth warning signs, postpartum home visits and oral health care, to the child health and doing lead screenings, oral care, a lot of developmental screenings and care coordination. These services are typically held at WIC centers with the Title V block grant. At Every Step, our gold standard is home visitation. With our model with the suitcase clinic, I wanted to take what we already knew with the Title V services, learning from some of our experience and listening to the participant's voice. And I wanted to expand that past WIC, past home visitations, and I wanted to take it where clients already were going. So that includes places like a health fair, like the Healthy Birthdays baby shower they had recently, being able to bring a nurse to one of those events and provide some of these services. Judicial systems, OB offices, and health departments. Next slide. We also provide Title V services. I always tell people right now, I do not have babies anymore. My babies are older, but this is a little bit my baby project in the last 2 years. So I wanted to take Title V or Title X services, which is family planning services. In the past, they have only been provided in a clinic setting. My previous work was a home visitation nurse, and there were so many times postpartum I would go into that home visit and they missed that postpartum visit at the clinic, whether that was because of transportation, childcare, whatever barrier they had, they could not make it. And we missed our opportunity to start birth control. And then either they were uninterested, already pregnant again, or they just could never reschedule that appointment. I wanted to take family planning services and put them in the nurses' hands that are already in the home for those postpartum visits. So the nurses that I have can go out into the home or at a mobile clinic and provide forms of birth control, including Depo, oral birth control, the patch, and the ring, and provide those to those clients on site. And then if the client was interested in a long-acting birth control, we would help assist them in making an appointment at a clinic, but also we could give them that, whether that's Plan B or Depo, right on that spot to make sure once they had to wait and get into that appointment, that we had them covered until they could get that long-lasting birth control. We also provide, one more. We also provide STI testing and treatment and expedited partner therapy with that program as well. Next slide. People who work in public health frequently discuss the ever-changing landscape of services, but I believe that this is imperative. Our community is continually changing. What we needed 5 years ago is not what our community is asking for now. We should be continuously asking what the community needs and how they want to receive it, and then adjust our services to meet those needs. At every step, we heard the need for increased access to care, and we answered that with mobilizing care into our suitcase clinic, bringing maternal health services, child health services, and family planning services directly to where the clients are. Next slide. So what are the benefits of doing a home visitation or community-based model? There are so many benefits. I may be a little biased because that is my prior role, but we can provide anything from improvement on families' economic status. We are constantly encouraging the families to stay in school, do continuing education, connect to a job, and moving through those barriers with them to walk alongside them. We have better maternal mental health. We frequently are testing every admission for their mental health and throughout their pregnancy. Also normalizing the testing and talking about the emotions that they will feel. We increase accessibility by bringing the services directly to them, either at their homes or throughout the community. They can provide early identification and intervention because we are frequently screening for whether that's mental health or child development, but we also can witness those delays prior to maybe the mom getting screened at the clinic, or we can witness any health issues and connect them to their provider as well. Improved maternal and child health outcomes. These models are proven to have better birth outcomes, increased child emotional and cognitive development, increased parenting skills and confidence, and school readiness. They are also cost effective for programs like some of our home visitation models, such as Nurse Family Partnership. They are known for every $1 invested in Nurse Family Partnership, you get a $5 return in the future. Next slide. So what do you need to be able to produce a model like this? You would need a medical director that has a willingness to work with this population, just like we speak about many of the things. You need a medical director who is passionate and compassionate about working with this population. Community-based nurses, you need nurses who are willing to get out in the community, whether that's a home, WIC, a park across the street from a school. You need a nurse who's comfortable with taking her services from outside of a clinic and bringing them out into the community. Community resource knowledge. Your nurse will not only be your medical expert, they are also going to be your community resource expert. They will wear multiple hats and kind of encompass that client holistically to support them from anything from needing assistance, getting connected to insurance and food, to their primary care provider. Then, of course, you need your indirect staff to help with coordinating intake and finances. But you will also need policies and procedures. The nurses who perform these job duties are very autonomous with very minimal direct supervision. So you need policies and procedures that are guiding their practices. And then relationship with community partners who share a common goal and common population with you. So for us, for maternal health, child health, and family planning, those are community partners like WIC, your local health department, and health clinics. Next slide. Funding. Funding is always the tricky part, and probably in the recent years, the hardest to navigate. But funding for these services are made possible with braided funding. So we use Medicaid reimbursement, your local Title V or Health and Human Services, local grants such as United Way, MCOs. This current model is made possible with the help of Molina. Or any other private grants that you can find. And then fee-for-service for your family planning programs. And then I know we're going to save questions for the end. So thank you.
Thank you so much, Becky. Really appreciate your work there and about home visiting. And I love what you were saying about the touch points to improve outcomes pre and postnatally. So thank you for all you're doing for Iowa families. All right, next we have Aubrey. Aubrey, take it away.
All right, thanks, Sarah. Hi, everyone. Like Sarah said, my name is Aubrey, and I'm the West Central Indiana Fetal and Infant Mortality Review Director. I'm stationed here in Tippecanoe County, Indiana, but I also oversee the FEMA process in a couple other surrounding counties as well. And I'm excited to be able to talk to you about local leadership and what that looks like from a FEMA standpoint and how we impact maternal, fetal, and infant health outcomes. So I like to start with a little bit of background about what a FEMA team is and what we do. So here in Indiana, we actually have state legislation and state codes that allow us access to records anytime there's a stillbirth or an infant death. So from 20 weeks gestation up to 1 year of life, those records include things like birth and death certificates, autopsies, police records, medical records, all of those things so that we can really understand exactly what happened with that death. A unique component of FEMA programs is we also integrate a family interview into this process. So I reach out to any family and give them the opportunity to share things from their perspective and if they think that anything could have been done differently. And it really helps us fully understand the circumstances surrounding that death. I put all that information together in the form of a de-identified case summary that I bring to our multidisciplinary team for the review process. And this team includes those with medical expertise, like our doctors, our nurses, our nurse practitioners. And we also include those with hands-on experience working face-to-face with families within the community. So home visitors, doulas, social workers, you name it. And that helps us keep a very broad perspective when we're looking at where things might have been broken down and leading to that death. So we also consider all the contributing factors that might have played a role, things like medical issues, social needs factors, education gaps, or service gaps in our community. And then we try to make recommendations either to prevent future deaths from happening related to similar causes, or if we didn't think that the death itself was preventable, we still look for opportunities to promote the overall health of women, infants, and families in the community. So the next step is bringing all of those recommendations to our community action team. So this team is also multidisciplinary, but instead of being focused in like the medical realm or those working with families, we try to focus more heavily on administrative or managerial roles with this team or those larger community leaders, essentially anyone who has the ability to impact or implement change on a larger scale. And we have them evaluate those recommendations, identifying any recurring topics or themes that we saw throughout the year, and determining where that change needs to be made, whether it's at the state level or within our healthcare systems or with the community directly through outreach and events, or it might be a combination of all three. And then we have the team develop and implement action plans in order to address those recommendations, considering things like potential barriers, funding that might be needed, new policies that need to be created, or maybe some new educational materials to get out to the community. Historically, over the last 5 years, our focus areas with the community action team have been resource mapping, community baby showers, and community education. So with resource mapping, the main things there are making sure first and foremost that new and expecting families are aware of all of the incredible resources that we have to support them during pregnancy and postpartum and while they're caring for their baby, but also making sure that all of those different services, whether it's in healthcare or the community, that they're aware of one another and know how to refer clients on so that if they can't meet a need directly, they know where to send them. And it's kind of that all-encompassing whole person care. With community baby showers, we do education, including some of the topics below that I'll talk about in just a minute. We also bring that resource component into community baby showers. We have several resources from the community be present at these events so families can work with them face to face. And then we also give out infant safety equipment like cribs and car seats with education on how to utilize those the most safely. Community education, though, is really the foundation of our prevention work. And some of those focus topics over the last several years have been fetal movement monitoring, safe infant sleep, preconception health, birth spacing and family planning, tobacco and substance use cessation, car seat safety, post-birth warning signs, and bereavement support resources. And you can see that within those topics, we are addressing fetal, infant, and maternal mortality prevention. And I could talk to you all day about how great I think our team is and all the work that we're doing. But in case you think I'm a little biased, I do have some data here that I wanted to share to back it up. So this is directly from the Indiana Department of Health. They published an infant mortality dashboard. This is specific for here in Tippecanoe County because it is the largest county that I work with, and it has a pretty hardy data set there. You can see in the bottom right, it talks about our infant mortality rates per 1,000 births per year, and that's over a 5-year period from 2019 to 2023. Our team started in 2020, and we really focused for the first year, year and a half or so strictly on reviewing cases. We were not putting action out into the community until we learned exactly what these deaths were why these deaths were happening and what we could do to prevent those specifically. And then partway through 2021 is when we really started to hit the ground running with that action team and getting education and resources out to the community and building our partnerships within the healthcare system. And you can see that from the time we implemented that action around 2021 until the most recent data that's been published in 2023, our rates went from 10.9 to 5.6. So we almost cut that in half. And I am just so proud of the team and all the work we've been able to do and that we can see it reflected in the data. All right. One of the things that Sarah and Megan specifically asked me to focus on when we're talking about this local leadership and community partnerships are the unique partnerships that we use with our FEMR teams to meet the needs of our community. First and foremost, whenever you're working in the maternal and infant health space, it's obviously very helpful to have your birthing hospitals and prenatal offices, pediatric offices at the table because they are that first line of defense that's hopefully interacting with all of these new and expecting families. But it's also incredibly important to have participation from other community partners that might be a touch point with families in other unique areas as well. It prevents people from falling through the cracks or just getting that extra push of information from more than one place. And those include WIC, home visiting, DCS, family resource centers, churches, daycare centers, libraries, moms groups, those types of things are all great options. Kind of to piggyback off of the previous session, doulas, I cannot say enough great things about you, and we are very fortunate to have an incredible community doula service team here in Tippecanoe County that we work closely with. Doulas develop a really unique sense of trust with the families that they work with. And it's something that the rest of us couldn't try to do on our own if we wanted to. They really develop that trust. And we know that families are much more receptive to education and guidance if it's coming from someone that they love and trust. So having those doulas working with families in the community is a huge asset. But one of the most innovative strategies that we've taken throughout the years is working with our local nursing schools. So in Tippecanoe County, we are fortunate to have Purdue University, Ivy Tech Community College, and St. Elizabeth School of Nursing. And we went to them a few years ago and asked if they would be willing to work with us in the fight to decrease fetal and infant mortality. And they resoundingly said, yes, we want to do something. So we have worked with them to have all students receive the Count the Kicks training that's now offered at Des Moines through Des Moines University. But in the new year, we will be transitioning to that Association of Women's Health Obstetric and Neonatal Nurses Changes in Fetal Movement Patterns course. And we are so excited for that. They also all receive a certificate from Cribs for Kids, their Safe Sleep Ambassador training. So again, we are preventing fetal and infant mortality, hopefully through this action. And since we started working with them back in the spring of 2023, we have had 754 future nurses trained. And that alone is so exciting to me. But if you think about the long-term impact this could potentially have, it's huge because these nurses might have their own babies one day. As the family member and friend who is a nurse, you know that everyone's going to go to them for advice. And now we know they have this solid foundation with this information. And then if they happen to go into a maternal and infant health field, the number of lives that could potentially be saved through their day-to-day interactions and sharing this education is huge. Okay, so if I could leave you all with one thing, if you are looking to start some local leadership in the maternal and infant health space, or if you're wanting to do something like a FEMUR program, I love alliteration. It helps me remember things. So hopefully this will stick with you. With local leadership, I suggest that you learn, lean, and leap. First, learn what already exists in your community for maternal and infant health. You'd be surprised that there's probably a lot more than you initially thought. And it can also be a great opportunity to learn about what maybe isn't there and gaps that need to be filled so that you can better serve your community. And then I suggest you lean into those community partners. Again, you will be surprised how many people are probably working towards the same goal, and you're all just kind of in your own individual silos. And you would be so much more impactful if you came together to work towards a common goal. And then don't be afraid to leap outside the box and cultivate those unique partnerships like we did with our nursing schools, because your impact can be even greater than you'd ever imagined if you look at those other opportunities. There's my contact information on the slide. If you ever want to reach out and discuss any of this any further, I'd be happy to do so.
Thank you, Aubrey. Really appreciate your perspective and all the work that you're doing at the local level. So I just have a couple of questions for both of you. Becky, you touched on this a little bit, but if you want to expand on it, and Aubrey, you too. So many of our local initiatives depend on short-term funding or grants. So how can you as a leader or other leaders sustain progress of the programs you've put in place, even though a funding source has ended?
Yeah, that's a great question. Thankfully, at every step, we do have a foundation team that is continuously assessing for possible grants. The tricky part with short-term grants is you cannot reapply with the same idea, which kind of pushes you to keep innovating what you're already doing. Or innovate and change what you're already doing so that you're proposing something new that hasn't been done. So that is, I would just keep looking for those like local private grants, whether that's reaching out to private insurance or your Medicaid and proposing gaps that you're seeing in the community and action steps you want to take to help with those gaps.
Great, thank you. Aubrey, do you have any perspective on this? I know you've been working on grant funding for some of the A1 training codes that you're sharing and all of that.
Yes, absolutely. Grant funding, like Becky said, can be a little tricky, especially when you're wanting to come up with new and innovative ideas every time. We are very fortunate to have so many community partners involved on our FEMUR team that I'm not just siloed into one area, but I do have lots of other directions we can go, looking at our hospital foundations, partnering with other individuals who might already have a grant that's working towards something similar, and just kind of collaborating on that. And then obviously, if there's anyone who's willing to volunteer or work, towards a common goal, those are great people to latch on to and have them join your team.
Absolutely. How can we elevate and support emerging leaders, especially those that have lived experience, to take on leadership role in this space?
I want to make sure I understood this correctly. So how we can kind of motivate people to do this work and get into these leadership roles?
Yeah, and elevate someone who's an emerging leader, maybe somebody that has a lived experience with something that has happened to them. I'm just thinking, as in Healthy Birthday, our ambassadors, lifting them up and feeling like they are emerging leaders in the work that they're doing, and especially because of their lived experience and everything that they have been through.
Yeah, I know with our FEMUR program, I've been really fortunate to work with a lot of mamas who want to speak out in honor of their little ones. One of the sweetest things a mom ever said was that working with our group has given her a purpose to her pain, and being able to advocate for others in honor of their little babies. So giving them the space to do that. We've had moms help us with safe sleep videos, and moms come to our baby showers to talk to families about those types of things, to promote Count the Kicks. We've had several families who said, I wish I had known more about fetal movement, and I want others to know that as well. So definitely being able to provide them a space to do so and keeping them as involved as they want to be is something we focus on.
Thank you. Becky, how about you?
Yeah, I think I would say a lot like other topics we've discussed throughout this entire session of knowing your resources. Um, there are community action networks and community groups that are going on that you could participate because they want to hear your voice. And so, like, I know every Title V agency is looking for family engagement and people to come together and help navigate and tell us how to promote our services. I know that there are leadership groups for specifically nonprofit agencies. So, exploring more on your own and connecting to the agencies doing the work.
Yeah, thank you. Yeah, I'm hearing so much about like Aubrey, you're saying the resource mapping and Becky about connection to resources and other community groups, like so important. And again, just a theme that we've seen over the past couple of days. Another question is about accountability. So I know Aubrey, you talked a little bit about data, but how do you measure leadership success beyond statistics? Have you had any experience with that? Maybe through shit like storytelling or hearing from a family later, or Becky, I don't know if you have any like evaluation process that you go through with families after a certain amount of time.
We do provide surveys and evaluations for our services. I think, particularly for the suitcase clinic, it is such a newer model for us that we are still evaluating the success. Um, and even though data doesn't tell the whole story, I would always encourage people to continue to watch your data and continue to assess, like I talked about with like your willingness to adapt services. I think that's the strongest point you need as a leader, to know when you misstepped or you're taking the wrong direction, and adjust your services to serve the community how it needs to be served.
Yes, and that really goes back to your listening that you were talking
Mhm.
about before, listening to inform care, right? Yep.
Mhm.
Thank you. Beautiful. Aubrey, how about you?
Yes. So we actually, part of the FEMA process is at the end of every year when you're trying to maintain those relationships with everybody and keep people coming back every year to continue doing this important work. One of the things they recommend is sending out annual surveys to your team. So that data does take a long time, like the 2023 data it's 2025 now, right? So that data is not immediate gratification. So there's other things that we do in the meantime. And we do these surveys with the team so that I can learn how to best keep them engaged and what they think would be most valuable so that we can keep them coming back to the table and keep them doing the outreach work that we need to do to keep saving babies.
Absolutely. Thank you. Okay, last question. What drives you to do this work?
I'm happy to answer this question. I am so glad that you asked what drives us and not how do you do this, because I think that's what everyone wants to ask me when they hear that my title is Fetal and Infant Mortality Review Director, because it's not natural to put fetal and infant and mortality in the same sentence. And I totally get that. But the why behind it is so much more important. So, of course, seeing our infant mortality rates go down is hugely motivating for our whole team. But even beyond that, it's the connections that we're able to make with these families and using their feedback to then help others that really keeps me going. And I have two little examples I'd love to share because it aligns really closely with the work that you guys do at Healthy Birthday. Um, One of the first interviews that I ever did was with a mom who lost her baby in the third trimester. And that was really hard to walk into as a new person in this role. And she told me that she had called and reported decreased fetal movement, didn't really get a sense of urgency about needing to come get checked out right away. Went in later that evening, and her baby no longer had a heartbeat. And through the sobs on the phone and during this interview, she just kept repeating, I wish I had trusted my instinct, and I wish I knew more about fetal movement to advocate for myself and go get checked out sooner. And it wasn't very long after doing this really hard interview that I learned about Count the Kicks for the first time. And her story absolutely inspired me to want to shout this from the rooftops and really push the Count the Kicks app in our community. Um, And more recently, I talked with a mom who also lost her baby in the third trimester, but she had a sudden rapid increase in movement. And she went in and got checked out. And because there was such good movement, they said, your NST is normal. You're all set. Go on home. And they actually told her not to stress and keep focusing on the movement, but to go home and try not to think about it and to relax. And later on the next day, when she came in, her baby also no longer had a heartbeat because she had, just been trying not to think about it like they had told her to. And at that time, they also found that she had very, very low amniotic fluid at the same time. And that's not something that would have been caught by that non-stress test. But now through A1's changes in fetal movement patterns course and algorithm, we know that additional testing like a biophysical profile or an ultrasound could have maybe caught that and prompted a sooner delivery and maybe changed this outcome. So in the new year, when we are going into our prenatal offices and pushing for that training for all of our prenatal staff, I will absolutely use this case and the previous case as an example so they understand the why behind this push. So to answer your question in a roundabout way, what drives me is these connections with the families that we're able to make and having the privilege of giving these little lives lost too soon a voice and advocating in their honor to help others is really what keeps me going.
Thank you. That's so poignant. I love how that is a privilege, right? To keep their voices going and to do the work so other families don't have to experience what those families have gone through, which is exactly what our founders founded this organization about. So thank you for continuing that work and saving lives. So, Becky, how about you? What drives you to do your work?
I love this question. And I always think it's important to remember to like ground ourselves back to why we do this work, right? Because it can be very heavy and exhausting. But I am a labor and delivery nurse by trade. And even to this day, I remember the first labor I ever saw in nursing school. And I just was amazed at how beautiful it was and powerful it felt during that moment. And I am one of four daughters in my immediate family, and I had the privilege of being raised by parents who taught me to use my voice. So, as I developed in my career, I have wanted to use my voice to give people that experience. I want them to feel like their healthcare experience was amazing and they felt empowered and powerful during that time. And for particularly women, I want them to feel like they are in charge of their healthcare.
Thank you for sharing. I'm a little choked up by both of your answers. I'm so moved by your passion, for your dedication, your incredible hard work. I can't imagine the hours and just the time that you put into the work that you're doing. And we just want to say thank you. Thank you for your leadership. Thank you for the impact and the change that you're doing in your communities, and for sharing these lessons and strategies so we can take that forward in the work that we're doing. So thank you both so much for being here today. We really appreciate your time.